Hello class, I am Dr. Caban. Today's presentation is on Chapter 5 in your textbook, starting on page 57. This will be a review of the nursing process starting with assessment, nursing diagnosis, and planning. This presentation will be broken into 3 lessons. Lesson 5.1 is the content on focus on assessment and data collection. Lesson 5.2 is the content on diagnosis. And lesson 5.3, I will review the process of planning. Let's get started. Upon completing your reading of Chapter 5 as well as previewing this presentation, you'll gain the following knowledge. You'll be able to identify the purpose of assessment, also known as data collection. You'll be able to discuss the 3 basic methods used to gather a patient database. You'll be able to differentiate objective data from subjective data. And also, you'll learn how to identify sources of data for the formulation of a patient database. The following knowledge you can apply to the clinical practice. You'll be able to collect assessment data from a patient and document it. The first 3 steps in a nursing process are assessment, nursing diagnosis, and planning. This is what we're going to review in Chapter 5. In Chapter 6, we'll discuss implementation and evaluation. So assessment entails gathering data. So during the assessment, you as a nurse will collect this data from your patient. You're going to collect patient health data, also collect data regarding specific topics, and then you're going to organize that data into a database and then document it. LPNs may be asked to collect data as part of the assessment. Although assessment is an RN function rather than an LPN function, according to most state nursing practice acts, you can assist the RN in gathering data. What are some approaches to assessment? Well, let's review them together. In a functional assessment, the data are collected in a structured format that helps us identify what our patient's strengths and weaknesses will be. Of course, within the context of essential human functions. 1 is a structured format to obtain a comprehensive database based on the 11 functional health patterns, which was formulated by Mary Gordon. Please take time to review Gordon's 11 health patterns in your textbook on page 58, box 5.1. Focused assessment focuses on specific problems. In a focused assessment, data are collected only for areas which are obvious problems, which are deviations from normal, or alterations leading to quick implementation of care. This approach is useful when the patient is in acute distress. Another approach to assessment is the basic needs assessment based on Maslow's hierarchy of basic needs. So interviewing our patients. The interview is a focused process that we use to gather data. It is not used for social interaction. Good communication is vital to adequate assessment during the interview process. Communication may be verbal, that means talking and listening, or nonverbal, such as facial expressions, body posture, movement, and gestures. The interview process consists of three basic stages. The opening stage is when we will build rapport with our patients and allow them to speak to us comfortably. In order to do that, we have to be sure that we notify our patients of the purpose of gathering data as well as how the information will be safeguarded. The body of the interview is during which necessary questions are presented. And in the closing stage is when the patient should be allowed to ask questions, especially about the interview process. We can use patient medical records when we are collecting data. This is also part of our assessment process. The medical record is a tool again for data collection as it helps us obtain information to interview patients or prepare for the day's patient assignment. The patient's medical record review should include review of the patient's face sheet and physician orders. Nurse's note at least the past 24 hours. Physician's progress notes and history and physical examinations, also referred to as the H&P. Medication administration record, any surgery operative report and pathology reports, diagnostic test, nursing admission history and assessment, fall risk assessment and skin assessment, as well as nursing care plan or problem list. Another way for us to obtain information or gather data from our patients is through our physical assessment. We would use techniques of inspection, auscultation, palpation, and percussion. During the physical assessment process, we will also carry out it in a systematic manner, that is from head to toe. The physical assessment is an ongoing process of data collection and examination focusing on the body systems in which there may be potential problems. The physical exam can be performed by the RN. Parts of the exam may be delegated to the LPN. A complete head-to-toe physical exam can take an experienced person 30 minutes to an hour to complete. An abbreviated examination is often done by the nurse on admission. The head-to-toe assessment initial observation would be that we would concern ourselves with the patient's breathing, how the patient is feeling, what the patient's general appearance is like, their skin color, and affect. A quick overview assessment is to be followed up with a more in-depth assessment as time permits. Sometimes a walking shift report is made in which each patient is quickly observed prior to exchanging information among nurses. Let's review the head-to-toe assessment in detail. When assessing the patient at the head level, we are going to assess them for their level of consciousness, their ability to communicate, their mentation status, as well as the appearance of their eyes. When assessing the level of consciousness, we want to identify whether or not the patient is awake, alert, and oriented. Remember that a patient can be awake without being alert. However, the patient cannot be alert without being awake. When we are assessing the patient's ability to communicate, we want to assess their primary language spoken or languages spoken and any communication deficits. When assessing their mentation status, assess their ability to comprehend and whether or not they can form thoughts. And also, assessing the appearance of eyes, we're going to look at pupil size and light reaction. The head-to-toe assessment entails gathering vital signs. There are 5 vital signs, and depending on the clinical setting, the LPN may be asked to obtain vital signs. However, this task may be delegated to the nursing assistant. Vital signs that are abnormal should be reported to the RN or charge nurse because additional actions may be required. So what are the vital signs you're going to assess? You'll assess the patient's temperature, the pulse rate, which includes assessing the pulse rhythm, strength, and the apical and radial rate. You'll assess the respirations. You'll assess the rate of the respirations, the pattern, the depth, and whether or not the patient's on oxygen. And then you record their oxygenation saturations. And their blood pressure. Assess whether or not the blood pressure is within normal limits and compare the blood pressure with previous readings. The head-to-toe assessment consists of also assessing patient's heart and lung sounds. When assessing the patient's lungs, listen out for rales, wheezes, or any diminished breath sounds. And when assessing their abdomen, note the shape of the abdomen, the hardness, bowel sounds. Ask when they had their last bowel movement. Document and assess whether or not they're voiding. Assess their appetite, and then also assess whether or not there's presence of nausea. In the acute care setting, heart, lungs, and abdomen should be auscultated at least once during a shift. When you're assessing your patient's extremities, you want to assess their ability to move all extremities well. You're also assessing their range of motion, skin turgor, color, and temperature. Also assess their peripheral pulses and edema. Our head-to-toe assessment also includes assessing whether there is presence of any tubes and equipment. So that means assessing whether or not your patient's on oxygen, if they have it via nasal cannula, trach mask, or whatever the case might be. Assess whether or not there's presence of chest tubes, NG tubes, PEG tubes, J tubes. Identify whether or not the patient has a Foley catheter, whether it's indwelling or suprapubic catheter. Also document if there's any drainage, any dressings. Obtain their pulse oximeter reading, and also document whether or not there's presence of traction devices. Remember that I stated previously that there are 5 vital signs. The 5th vital sign is actually considered the pain assessment. So pain is the 5th vital sign. So during the head-to-toe assessment, you're going to assess the patient's pain status. Assessment in long-term care setting has some special considerations. This varies from assessment in the acute care setting or also assessments in the home care setting. In the long-term care setting, you want to do an extensive initial assessment of the patient as they are admitted to the facility or as they enter the facility. Be sure to reassess patients at fixed intervals as their condition may change. You want to conduct physical assessment, obtain health history, medication history, as well as conduct a functional assessment. A functional assessment is often a supplement to the history and physical examination. A functional assessment yields information about the patient's level of independence and the patient's ability to perform ADLs. A functional assessment helps us identify problems that can be addressed by nursing. Let's take a look as to how assessments in home care differ from assessments of patients in the long-term care setting. Patients in the home care setting will be assessed by the patient's RN the initial visit. The initial patient assessment will be conducted again in the home setting and is usually performed by the RN. The LPN can provide private duty in-home care to the patient and will need to perform daily assessments and maintain necessary documentation. Any changes found in your patient on your assessment should be reported to the RN supervisor. It is now time for us to review a couple of questions regarding the first part of this presentation. Let's take a look at this question together. As part of an assessment, the nurse asks for information from the patient. This information is a subjective indication of illness perceived by the patient, and it is called, is it A, assessment, B, symptom, C, sign, or is it D, observation? Take a moment to consider your response. The correct response here is B. Symptoms are subjective indications of illness that are perceived by the patient. Please know the difference between subjective and objective. Let's move on to the next question. Question 2. All of the following components can be found on the chart except which? Is it A, face sheet, B, physician's orders, C, patient's H&P, or is it D, patient's nurse assignment? Again, take a moment to consider your response for this question. The correct response here is D. The patient's nurse assignment is part of the unit staffing information posted on each unit. It is not part of the patient's chart. Question 3. Linda knows as part of her nursing assignment that she is to review and update the nursing care plan on her patients. How frequently should she do this? Is it A, hourly, B, every shift, C, every 24 hours, or is it D, weekly? Consider your response. The correct response here is C. The nursing care plan is reviewed and updated every 24 hours. Necessary changes can be made at any time. Lesson 5.2, Diagnoses. Upon reading your chapter, as well as previewing this presentation, you'll be able to correlate patient problems with nursing diagnosis from the accepted North American Nursing Diagnosis Association International list, also known as the NANDA. You'll gain the following knowledge to be applied to the clinical practice setting. You'll be able to analyze the data collected to determine patient needs. You'll be able to identify appropriate nursing diagnosis from the NANDA list for each assigned patient, and then you can organize and prioritize the nursing diagnosis. Let's continue. Once you have assessed your patient and have collected data, you will gather the information, and then you would use the data to be analyzed for cues that indicate deviations from the patient's norms. What are cues? Cues are pieces of data or information that influence decisions. Your analysis includes taking the data and sorting the data, or taking related data and grouping or clustering the data. Also, during your analysis, you will identify any missing data and also identify inferences which are to be made regarding the patient's problems. You've conducted a thorough assessment on your patient. You've analyzed the data you've collected. Now you are ready to devise nursing diagnosis based on the information you've gathered and the information you have analyzed. Before you can move forward with developing a nursing diagnosis for your patient, you should have a found understanding as to what is meant by this terminology. So a nursing diagnosis statement indicates the patient's actual health status or the risk of the patient developing a problem. It also identifies the causative or related factors and specific defining characteristics such as signs and symptoms. The nursing diagnosis differs from the medical diagnosis, whereas the medical diagnosis is never included in the construction of the nursing diagnosis. The RN indicates the nursing diagnosis, but you as the LPN is expected to contribute to the plan of care once the diagnoses have been identified. When you hear the term etiology, basically what that means is you want to identify what is causing the problem, so the causative factor. So etiologic factor is also used interchangeably with the terminology causative factor. So ask yourself, what is the difference between objective data and subjective data? Again, you must familiarize yourself with these two terminologies. So subjective data are data in which the patient tells you, and objective data will be the data you collect by examining the patient. So signs are abnormalities that can be verified by repeat examination. These are objective data. Symptoms are data that the patient reports to you that cannot be verified by examination, and these are considered subjective data. Again, to reiterate, nursing diagnosis differs from the medical diagnosis in that the nursing diagnosis defines the patient's response to illness, whereas the medical diagnosis labels the illness. Prioritizing your plan of care based on patients' problems and presentation. Problems are ranked according to their importance. According to their physiologic needs for basic survival takes precedence. Remember your ABCs: airway, breathing, and circulation. After physiologic needs are met, safety problems take priority. Every nurse must attempt to look at each patient holistically, keeping psychosocial needs in mind while working on physical problems. Your order of prioritization can be guided by the hierarchy of needs adapted by Maslow. Developing nursing diagnosis in the long-term care setting is the responsibility of the RN, but the LPN employed in a long-term care setting can begin the care planning process when the patient is admitted. The supervising RN will then develop the plan of care, the nursing diagnosis, review the plan of care again, and modify it as needed. He or she will also finalize the plan of care for the chart. In the home health care setting, the RN will develop the nursing diagnosis, which should include problems identified in the patient's family's ability to cope with the illness or situation, and also identify any teaching needs for the care of the patient. The nursing diagnosis and care plan should encompass any considerations for the patient's needs and the family's needs as well. Time for a brief question. Which of the following sets of assessment data is most likely to be present with the nursing diagnosis risk for infection? Is it A, fever, dysuria, change in urine concentration, and urinary urgency? Is it B, abdominal pain, sore mouth, hyperactive bowel cells, and leukopenia? Is it C, fatigue, electrocardiographic changes, dependent edema, and activity intolerance? Or is it D, abdominal incision, decreased hemoglobin, and indwelling catheter is present? So again, which one below will identify that the patient is at risk for having an infection? Again, is at risk for infection. The correct response here is D. Assessment data used to make a nursing diagnosis includes examining the patient's medical history, physical exam, laboratory analysis, and data for the nursing history and assessment. A risk for nursing diagnosis describes human responses that may develop in a vulnerable person. Options 1 and 2 contain data that indicates an actual infection, while option number 3 has no data to indicate an increased risk for infection. Therefore, option number 4, or D, is the correct response. Let's move on. Lesson 5.3, Planning. So again, consider your assessment, your diagnosis, now planning the care. Upon completing this part of the presentation, you'll be able to identify appropriate outcomes criteria for selected nursing diagnosis, and also you'll be able to plan goals for each patient and write outcome criteria for the chosen nursing diagnosis. You'll gain the following knowledge to apply to the clinical practice. You'll be able to write specific goals and outcome statements. You'll also be able to plan appropriate nursing interventions to assist a patient in obtaining the goal or expected outcomes. So in your planning, you want to identify goals and expected outcomes. Goals are what is to be achieved by your nursing intervention. Short-term goals are achievable goals within 7 to 10 days or before discharge. Your long-term goals are those goals you have set forth for your patient that may be achieved within weeks or months. They are often related to rehabilitation. Expected outcomes is a statement of goal which the patient is to achieve as a result of your nursing intervention. The patient or significant others should always be included in the goal setting process. Interventions, also referred to as nursing orders, or also referred to as implementation. Interventions are designed to alleviate problems and to achieve expected outcomes. They should include giving medications and performing ordered treatments. Interventions are individualized based on the patient's needs. As a nursing student, all I could remember was my instructors informing me that if it's not documented, it was not done. That is a huge takeaway for me, as I am very diligent about documenting all the care that I provide for my patient and ensuring that my documentation is timely. So documenting is crucial to your practice. Planning is not complete until the plan is documented, and it is part of the patient's medical record. Plans constructed by the LPN must be reviewed by the RN before they are placed in the chart. The plan of care should be reviewed and updated once every 24 hours. Question number 5. This is our final question for this presentation. Let's take a look at this question together and consider your response. A nurse has established expected outcomes for an assigned patient. The nurse carries out this important activity for the purpose of A. Evaluating the occurrence of complications, B. Measuring quality of care, C. Measuring the effectiveness of nursing interventions, or is it D. Stopping care when outcomes are met? So what is the purpose of establishing expected outcomes? Well, the purpose of us establishing expected outcomes is C. So it can direct our nursing interventions and maintain continuity of nursing care, and also allows us to measure the effectiveness of any interventions we provide to our patients. The end. This concludes my presentation on assessment, nursing diagnosis, and planning, found in your textbook, Chapter 5. Thank you.